to Science Elite. Today's lecture is especially for pharmacy students, and the topic which I am going to cover is local anesthetics and general anesthetics. All the pharmacology part I will be covering in this video. For more pharmacy related videos and science related videos, you can subscribe to my channel. So let's start with the introduction of anesthetics. Anesthesia. What is anesthesia? You all must be knowing that during a surgery, to avoid the pain, doctors inject a chemical substance to the patient. What is that chemical agent which doctors inject to a patient before the surgery? Yes, that particularly known as anesthesia. Anesthesia was one of the biggest discovery in the field of medical science, as it has solved many problems which comes during the surgery, and more especially the pain which the patient goes through the surgery in the past years when anesthesia was not there. Everything was just solved after its discovery. So the basic introduction of anesthesia is a state of controlled temporary loss of sensation or awareness that is induced for medical purposes. Okay, with this definition you can easily understand that anesthesia controls and also makes a temporary loss of sensation which is reversible in every cases, and due to this the patient who is undergoing a difficult surgery, long procedure in which the pain must be involved, all of that will be eliminated. The patient will not feel anything during the surgery, during the operation with the injection if it is given to that particular patient. Next, it will include some following points like analgesia. Yes, when we give anesthesia to a patient, then the patient will be relieved from the sensations of pain, and that particularly known as analgesia. Next is paralysis. Paralysis means muscle relaxation. Amnesia, loss of memory, as the patient should not get any kind of memorable things about a particular operation. So in that case, amnesia is also produced when anesthesia is injected. Unconsciousness, in the case of general anesthesia, the patient may also undergo unconsciousness condition. Okay. In the case of local anesthesia, that is not there. Only in the case of general anesthesia, patient undergoes unconsciousness. The patient under the effects of anesthetic drug is referred to as being anesthetized. That means that if a patient is given the anesthetic drug, we could call that particular patient to be anesthetized. That means the person kya hai? Anesthetized. So let's go on. Classification of anesthetics. It is, first one is local anesthetics, general anesthetics, and regional anesthetics. One by one we will be covering all these three. So anesthetics can be grouped into following three branches: local anesthetics, general anesthetics, and regional anesthetics. So first we will be starting with local anesthetics. Local anesthetic, what do you mean by the term local? Local basically means when it is restricted to a certain area. Okay, local anesthetics are the drugs which causes reversible loss of sensation. That means the sensations are lost for some time, and after that it can be regained. And local means if it is restricted to a certain area, that means your whole body will not be in the anesthetized condition. Only a certain part where the anesthetic has been given, only that part will be anesthetized. That's why this type of anesthesia is known as local anesthetic. Okay, then I have explained already that it is restricted to a certain area only. Then they block the conduction of nerve impulses, okay, if of any restricted area. That means for a particular area, the conduction of nerves, action potential, okay, will be blocked. So if there will be no conduction of impulses from that particular area, no transmission, then in that case, that part will be fully anesthetized. Next is when these are applied to a mixed nerves, cause muscular paralysis. That means mixed nerves. What are mixed nerves? That means sensory and motor together when are placed somewhere in the certain parts of our body, the mix, and if we inject the anesthetics to that particular area, in that case what will happen? The muscular paralysis will occur. So we should avoid giving the anesthesia in certain parts of our body where the which nerves are present. Okay. These do not cause any structural damage to neurons. Okay, so that this means that neurons will not be damaged, no structural damage will occur. Now history. We all know that in certain eras there were different kind of anesthetics which were found by the particulars of that particular era. The journey of anesthetics has been started long ago. The first local anesthetic cocaine was discovered to have anesthetic properties in the late 19th century. That means cocaine was already being discovered in the late 19th century and it was being used also in that time. Next one is like Albert Newman isolated cocaine. He tasted his newly isolated compound, noted that it has numbed the tongue, and from there the new era began. So, and then Sigmund Freud studied cocaine's physiological conditions, actions, and Carl Kohler introduced cocaine into clinical practice in 1884 as a topical anesthetic for ophthalmological studies. You all must be knowing ophthalmological studies, that means eye-related surgeries, ophthalmologic. There it was used in 1884 in the clinical practices. Then shortly thereafter, Halsted popularized its use in infiltration and conduction block anesthesia. Infiltration anesthesia and conduction block anesthesia, these are the two techniques of giving the anesthesia. So this we will be studying in the later part of local anesthetics. Till then, please stay connected with us in the whole video and for part 2 also. So this was all about the history of local anesthesia. It is very simple to remember. Next one is this cocaine. Because of its toxicity and addictive properties, we all know that cocaine has a lot of toxicity also and it is addictive also. So in that case, the substitute for cocaine was being founded after that, just to reduce its toxicity. Okay, then procaine, which was a prototype that was being formed by Inhorn and his colleagues in the year 1892, and the prototype, which is known as procaine, was isolated and was found. The most widely used agents in today's practice for different type of surgeries are lidocaine, bupivacaine, and tetracaine. These are less toxic as compared to cocaine, and it has wide uses nowadays. And almost in every surgery, lidocaine is used, and many others are also being discovered which are used recently widely all over the world. Chemistry. For studying the pharmacology of a particular compound, we should know the chemistry also, little bit chemistry we should know. So let's study some structures. Typical local anesthetics contain hydrophilic and hydrophobic moieties that are separated by an intermediate ester or amide linkage. We all know hydrophilic and hydrophobic moieties. Okay, these moieties are separated by ester or amide linkages. We can easily see these in the structures also further in the next slide. Hydrophobicity increases both the potency and duration of action of the local anesthetics. This is the next most important point, that hydrophobic character. That means more lipophilic the drug is, it is the more potent and it has enhanced duration of action. Okay, the reason behind it is very simple and we will be studying in the further slides, okay, in detail. The receptor slides for these drugs on sodium channels is thought to be hydrophobic. Then this is the structure of the local anesthetics. We can see certain kind of linkages. Okay, amide linkages can also, like in lidocaine, we can easily see amide linkage. Okay, so this is a linkage. Then here also a linkage. In procaine you can see an ester linkage, whereas in lidocaine you can see an amide linkage here very easily. So now let's talk about classification of local anesthetics. Local anesthetics are classified into two types, injectables and surface anesthetics. Then further they are classified into different types, like injectables are classified into three main types: short potency, intermediate potency, high potency. Then again, surface anesthetics are classified into soluble and insoluble. Then further they are classified into different drugs. One by one we will be seeing. Short potency category involves two kind of drugs, that is protein and neuroprotein. Then again, intermediate potency involves lidocaine and lidocaine. High potency drugs involves tetracaine, bupivacaine and dibucaine. So these are the classification of injectables. Now the next one is surface anesthetics, and surface anesthetic is of again two types, soluble and insoluble. Soluble one contains three drugs, cocaine, lidocaine, tetracaine, and insoluble contains benzocaine, diaminobenzoate and oxythazine. So all these drugs are classified under the category local anesthetics. So later on in the second part we will be discussing about local anesthetics and general anesthetics series of pharmacology. Further, I will be bringing second part, which will be further after classification, containing the mechanism of action. For that, kindly stay connected to Science Light channel, and also if you have any doubt regarding this particular part, you can comment down in the comment section and I will respond to all your queries. Kindly like my channel and also subscribe and share. Thanks a lot. Have a great day all of you and stay connected.